Hello, my name is Varsha Solanke, and I'm one of the coordinators for Nursing and Med Programming. I would like to welcome you to the Masters of Science in Nursing Admissions panel. Today we have speakers representing nursing schools from across the country, and we will have additional speakers joining us shortly. During the first half of the panel, the representatives will be the first half of the panel will be dedicated to introductions and a brief overview of the nursing programs, and the second half of the panel is dedicated to answering questions which have been previously submitted by our attendees. To get started, I would like our speakers to go ahead and introduce themselves and explain what programs that you offer.
Good morning. I'm Debbie Lindell. I am director of the Graduate Entry Nursing Program at the Francis Payne Bolton School of Nursing, Case Western Reserve University in beautiful Cleveland, Ohio. Cleveland is located on Lake Erie and kind of just directly across from Canada, actually. I'm really pleased to have the opportunity to share with you today about our master's level nursing programs. We were asked to share the mission of our school, and it's kind of long, so I've sort of put it into bullets. But we aim to nurture a learning community, provide leadership in innovative research and education and interdisciplinary scholarship and practice with the aim of promoting health and reducing the burden of disease both nationally and internationally. Our university is a private, research-intensive university, and we have about 10,000 students overall, of which about half are undergraduate and half are graduate and professional. We offer educational programs from baccalaureate at the undergraduate level, leading to the BSN degree, through doctoral, leading to the Ph.D. or the D.N.P, and we have a combination, Ph.D., D.N.P. The D.N.P, for those of you that may not be too familiar with it, is the Doctor of Nursing Practice, practice-focused doctorate. We have two master's programs, and they are the Graduate Entry Program that I direct, which is for individuals who have a B.A. or B.S. or higher in a non-nursing degree and want to enter nursing. Our students who admitted to this program are admitted for the pre-RN phase leading to the Master of Nursing degree, the MSN, and the D.N.P. They can also apply for the Ph.D. program if they wish. In that program, we have a senior year in professional studies option as well. For the MSN program, for those who are already registered nurses and want to go into advanced practice, we have 10 advanced practice majors, and one more coming along, and two subspecialties, one of which is flight nursing. It's the first advanced practice flight program in the country. And those students can do the D.N.P. or the Ph.D. Concurrently with the MSN, and we have nurse educator tracks for all of those levels, MSN, D.N.P., and Ph.D. Admission requirements, just very quickly, they're posted on our website, but a minimum overall GPA for both of the master's programs of 3.0 and a graduate admission test is required. Of course, there are prereq courses for the graduate entry program, and then for the MSN, there are just really being an RN, having an undergraduate degree in nursing and statistics. Just a couple of quick things about our university. We've been in business since 1923. We are ranked 15th in the country by U.S. News and World Report. We have 7 centers of research, and we are the home of C.N.E Institute, Quality and Safety Education in Nursing, which is an initiative that started about 6 years ago. We do a lot of interprofessional education with the medical school, dental school, social work, and anybody else we can find. And the MN students in the graduate entry program and the School of Medicine students run an interprofessional student-run free clinic that is fully interprofessional in operation and care delivery, and we believe it's the only one of that type in the country. Thank you.
Hi, my name's that on? My name's Jennifer Lillibridge. I'm from California State University, Chico, and I'm here to talk about our master's program. Chico is in rural Northern California. It's about a 15,000 student university. We have a beautiful campus, and so we are in a rural area, though. We have a master's program that has been in existence for quite some time, and the mission of this school really focuses on, our BSN program focuses on creating nurse generalists and in terms of nursing professionals, and we have two options in our master's program. We do also have an RN-BSN program that is thriving right now, and our master's program has been an educator focus for many, many years, and so we do graduate nurse educators, and this year we went to an annual admission cycle, which is new for us. Our program is 5 semesters long, and we have been admitting every other year for many, many years. We have gone to an annual admission cycle due to demand, and that started this year, and we have also added a leadership option to our MSN program, so that we admitted actually solely to the leadership option this year because that was where the interest was. But our plan is to create 2 cohorts every year and admit to both, so that we have a core year of courses that both options would take, and then at the 3rd semester, students would split off into the last 3 semesters being either leadership or education. So we're very excited about this. We did admit 14 students, and we'll have 15 next semester because we had a student change their mind about which option. And they are all very excited and came in very enthusiastic, so we're very excited about being able to offer leadership to our rural area of Northern California. Admission criteria into our program: students are required to have a BSN, they are required to have a 3.0 GPA in the last 60 units of study. We currently require the GRE, and we require statistics within the last 7 years. Because we are looking at an ADN to MSN streamlined, seamless progression, we expanded our statistics to 7 years so that if students took that before they came into their ADN program, they would still be current in terms of moving into the master's program. And so we are looking at the nurse educators. We educate a lot of nurses for local community colleges and also nurses that come in to teach part-time at the university with us. Some of those nurses and educators do go on to get Ph.D.s and have come on to our faculty as tenure-track faculty, and many have remained in the area in local community colleges. The nurse educator option, everyone is currently in some sort of managerial position with the new option, and those students are in a variety of areas geographically because our program is online. We do have all the theory courses are online, and we have, in the leadership option, there is 1 clinical preceptored practicum in the final semester. And in the educator option, there are 2 clinical practica, and we do have students, both of those are preceptored, one with a master teacher and one in some sort of facility, healthcare facility. And we do try and keep students in their geographic area for those clinicals. And in the educator option, we do have a simulation experience as part of their final teaching practicum, because we do have an internationally recognized simulation center at Chico State, and so students learn how to run simulations and how to take groups of students through a simulation process and have the opportunity to actually participate in writing a simulation experience. So that's all. Thank you very much.
Sorry I'm late. I'm Dr. Wanda Borges from University of San Francisco. I'm the Associate Dean of Graduate Programs. I'm new to this area. I moved here from New Mexico in June, and I'm really excited to be here and in California, and excited about a lot of the programs that are happening. The mission at USF is to create a more humane and just world, and the attributes that go along with that are what we consider the San Francisco advantage or the California advantage, and the higher standard that we set for our students and a commitment to justice in a global community so that students are prepared to change the world from here. So that's our mission. That's a pretty lofty mission, but that's one of the reasons that I moved to USF from New Mexico. So our programs are, for the master's degree, are really focused around the clinical nurse leader role. And this role is one that's emerged from the American Association of Colleges of Nursing to be in alignment with the Doctorate of Nursing practice. And it's really about teaching students to be leaders at the unit level or the microsystem level. And so we have several ways to get into our master's program. We have a RN to MSN, which includes ADN and BSN nurses who are admitted into the MSN track. And that track has courses that start from the very first semester that look at that C&L role and the expectations around that role in assessing a microsystem, identifying an area of need in collaboration with an organization, and then working on a project that will actually make an evidence-based practice change at that unit level. So we admit ADNs, and they take some extra writing courses, and we admit Bachelors of Science in Nursing. And the coursework is really focused around helping them to be leaders on a unit. So whether it's a charge nurse at the unit level in a hospital setting, or whether it's working in a primary care setting or a community clinic. And with the Affordable Care Act, I think a lot of that care is being moved into the community. And so the admission requirements are a 3.0. Although we do look at transcripts and can conditionally admit for people who maybe have been out of school for a while and didn't do so well in their associate degree program or their undergrad program. So we can make some exceptions. The other criteria that we look at is your reference letters, so you want to have strong reference letters. And we also look at your writing. So the writing letter that you give to us is your letter of interest. And another component that we look at is special experience that you've had. So I would say that in your writing, if you're going to apply for that program, you really want to focus on highlighting what you've done in your career, whether you've volunteered for something or whether you have some special circumstances that you've lived in your life that have given you just a little different point of view. We also offer a master's entry program. So the master's entry program is for people who have a baccalaureate degree in another field. We have some prerequisites that are science prerequisites that you have to take, but once you've taken those, then you apply to the program. We don't require the GRE for either of those tracks. However, we do require currently a CLEP test for English because we really believe your writing skills need to be strong, and we need to know where you are from the beginning so that we can support you in your writing. And then for the master's entry program, in addition to getting the basic nursing training and being able to sit for your NCLEX, your licensing exam, then you also gain the skills of the clinical nurse leader. I believe USF has a strong commitment to justice and to preparing our students to work with those less fortunate, those who are having health disparities or who are in need. And part of what that experience is by giving students the opportunities to go on immersions where they gain clinical hours as well as invaluable experience in working with some of the needy in not only our area, but in other parts of the world. But one that I got to experience just this summer was an immersion to the Central Valley. And a team of baccalaureate nurses, C.N.E nurses, master's level nurses, nursing students, and doctorate of nursing practice students all went to Fresno, and for a 2-week period worked with 2 elementary schools in 2 different school districts, and were able to conduct multiple vaccinations as well as assessments. And of those students, those elementary students, as well as some of their family members, and then also ran a homeless clinic where they did foot care in Fresno for over 150 homeless people, and did physical assessments and some evaluations in teaching. And really, that was an eye-opening experience for many of those students. They saw more than 600 people during that time. And those are the kinds of experiences we encourage, so that when you come out of USF, you not only have the skills and training that you need for being the nurse leader at the master's level, but you also see the need for changing the world and for making it a better place for all of those, not just those of us who are fortunate enough to have the resources, but for others who don't have them as well. Thank you.
Good morning. I'm Ernie Rushing from Duke University School of Nursing. Talking about our MSN programs, we do have multiple programs expanding across not only family nurse practitioners and adult gero programs, pediatrics, pediatric acute care, but also the non-clinicals as well. One of the things that we are focusing on is in this idea of transforming healthcare, and as healthcare seems to be changing with almost each passing day, we want to make sure that we are preparing our nurses to be leaders in the field, to be able to advance the cause of nursing and what they're doing with it. So we have multiple ways of doing that. As you're looking at the decisions of what we offer and the process for admission, one of the things that we look at across all of your transcripts and things like that, your writing is going to be important, personal statements are going to be important. And one of the things that we like to look at is the personal statements on applications and why you're passionate about it. It's a very challenging field. Nursing is a very challenging field, and being passionate about it is going to be important. So we're looking at those sorts of things. We understand that scholastics may differ, and so we are looking for GREs. If you have a 3.4 or higher, however, we will save you from having to take that 4-hour party. So they are waived for any student with a cumulative grade point average of 3.4 or higher. Your letters of recommendation, what the things that faculty are looking for on those are, if you can get a letter of recommendation from someone who has the job that you are applying for. If you're looking for a family nurse practitioner program and find a family nurse practitioner who says that you would be a strong candidate for the program, that's things that we're looking for from an admissions standpoint. Outside of that, our non-clinical programs in leadership and in informatics and education, those are things that we're also looking at. And it's not only just a nurse practitioner standpoint, but also a non-clinical setting as well. There's an opportunity and a need for leaders not only in the clinics, but also in management. And so we're looking at a way to develop those. Now we do have programs like our family nurse practitioner and our adult gero primary programs, which are available distance-based. So you can stay here and you can enroll at Duke. We actually we have an office of clinical placement that will find all your clinical placements for you here in California. You can also, you'll come to campus a couple of times throughout your entire program. So that's a way to get a little bit of the on-campus experience, but doing most of your work from home. And being able to take that information going into our Doctor of Nursing practice or our Ph.D. programs are available. Anyone looking for those, the graduate level, the doctoral nursing programs, there's a lot of incentive at this point to start looking for the doctoral degrees, whether they be in practice or in philosophy. And so we encourage you to start looking at those options. And if you have any questions about the admissions processes in particular, everything is listed as what we're looking for, what we need, and ways to enhance your application are available online. So thanks.
Good morning, everyone. My name is Elena Siegel, and I'm on faculty at the Betty Irene Moore School of Nursing here at UC Davis, and we're on the Sacramento campus. And thank you all for being here this morning on a Sunday, on a beautiful day. Our programs are relatively new. We brought in our 4th cohort of graduate students. We were launched in 2010 with an historic investment from the Gordon and Betty Moore Foundation. We're very grateful for that. We have 4 graduate programs, a Ph.D. program, and I'll talk about that just briefly in a moment, and then 3 master's programs. One is a master's in science in leadership, and the other 2 are clinical tracks, a master's in science for nurse practitioners and a master's in health services for physician assistants. Our nurse practitioner and physician assistant program is a combined program, and it is the only program in the country that is a combined interdisciplinary PA and NP program. Our master's in science and leadership is a 5 to 6 quarter program focused on advancing your leadership, and you come into the program with an RN already and a bachelor's in nursing or in health-related field. I'll back up for a minute and jump back to our mission statement. It's to cultivate academic excellence and focusing on interdisciplinary and interprofessional education, and then also research where we partner with the communities. And our mission is focused around 5 core values, and first is leadership. So we're building, as many on the panel have talked about, a real focus on leadership and building the capacity for advocacy and action at all levels within nursing and within healthcare. We also have a strong focus on interprofessional and interdisciplinary education and how to enhance the capacity of healthcare providers to work together as teams and to communicate. The next is transforming research, where we are actually working directly with the community and reshaping health systems, enhancing health, with an emphasis looking at rural health, aging, and diverse communities. The last two are cultural inclusiveness, approaches on how we can appropriately care for and involve communities in a culturally appropriate way, and with our relevant research. And then last is innovative technology. How can we use technology to advance health and advance our goals for research, education, and practice in healthcare? In terms of admissions, we're looking at a 3.0 to come into our program. We do not require the GRE. You can go to our website and look at all of the requirements. We would like you to have letters of recommendation, and those are a very important aspect of the application process, and we have information at the website about tips and things to look at. We also have essays that you'll complete, and as just echoing what others have said about really providing your own voice on your applications and letting us know who you are and what your passion is. Our master's program, I think I said, is 5 to 6 quarters long. Our N.P. and P.A. programs are 2 years, and the P.A.s add an extra quarter to that. I think that's it. Thank you.
All right, the first question is for Dr. Lillibridge. How heavily are extracurricular activities weighed when being considered for admission, and what are the best extracurricular activities to look into?
Okay, first of all, I have a little bit of a hearing problem. Can you just repeat them a little louder for me?
Sure, sorry about that. How heavily are extracurricular activities weighed when being considered for admissions, and what are the best extracurricular activities to look into?
Okay. We also, which I didn't mention before, require an expression of interest letter to look at writing, and in that letter is part of what we ask for, that you look at some of the things that would make you a good candidate for our program. We don't specifically require extracurricular activities, but if you're looking at the leadership option or the educator option, which you do need to choose at admission, we would like that letter to focus on what maybe areas that you have done previously related to leadership or education, and where you would like to go with that degree. So although it is not a very specific criteria, we look at the areas that you might already have in your practice, or where the directions that you do want to go in your practice that would be related to the option that you're interested in. Thank you.
All right, this next question is for Dr. Borges and Mr. Rushing. What is the difference between an NP and MSN degree? And do I have to obtain an MSN degree before getting an NP degree?
I can answer that from our perspective. So all of our advanced practice degrees now are at the doctoral level. We made that conscious choice when the American Association of Colleges of Nurses made the recommendation that all advanced practice nurses, nurse practitioners, C.N.Ss, certified nurse midwives, and certified registered nurse anesthetists be at the doctoral level by the year 2015. So I would encourage anyone going into an NP program at this current time to really consider not stopping at the master's level, that even if you get into an NP program that is at the master's level, you want to get a doctorate of nursing practice. And what that doctorate of nursing practice offers you is really looking at a macro system evidence-based practice change. So what we know happens in research today is that it takes anywhere from 20 to 25 years for research to actually get into practice. So things that have been shown to actually prove to help people don't even get into practice for 20 to 25 years. So we want to shorten that, and that's the whole mission driven behind the AACN's recommendation. And what the Doctorate of Nursing Practice prepares nurses to do is to be leaders in change at a macro system level. So making evidence-based practice change, translating research into practice, and making those changes that have been shown to improve health to actually work in a practice setting. And that takes some skill, and so it's a lot of interprofessional, interdisciplinary practice. You learn about leadership, leading change in an organization, and leading teams in making that change.
And no, we did a little bit differently, so we still maintain our MSN programs, and we do have the D.N.P on top of it. But I also would echo the sentiments. Don't stop with the MSN. As things start to change, if they start to really mandate and state by state that you would have a D.N.P, you don't want to be hung out there when you're 45, if that actually comes into play, and have to go back to school then. So if you're going to go, just go all the way and plan on getting your doctoral degree. Outside of that, the NP for us is the requirement for the D.N.P. You have to have some sort of nurse practitioner background. You can get an MSN degree in education and leadership and informatics, but those don't have the practitioner background to get into our D.N.P program. So that's the difference in how ours is laid out.
And we take another view. As you can see, one of the great things about nursing is that there's lots of ways to achieve your goals, and lots of ways that nurses at all levels can improve health care and patient care. At Case Western, we also are currently keeping our MSN and our D.N.P separate, but we do have seamless admission and progression through them. And for our D.N.P, we take a broader approach, and we do not require that someone be a nurse practitioner. They can be an educator, they can be an administrator, and our curriculum allows for that.
All right, this next question is for Dr. Siegel. What advice would you give a student who is deciding to go into nursing school later in their undergrad career or later in their life?
That's actually something that I did. I came into nursing just 12 years ago, so I'll talk to you about it from my perspective and my experience. I think the first thing is to really try to gain a true understanding of what the arena, the nursing arena is about, and how you can spend some time volunteering, working in healthcare settings, and talking to as many different people as you can. I actually had no idea, really, when I came into nursing, that there were so many different opportunities and so many different pathways that you could take. And the more people that you can talk to really figure out which program might be the best fit for you. And as you can hear from us, there are so many different pathways that you can take. And now is a great time because nursing has expanded so much and there is so much emphasis on nursing as part of the healthcare team and with healthcare reform that I think you'll have a wonderful opportunity to really get out there and talk with people, and they're willing to talk and interested in talking to you. And watching how nursing fits into the healthcare team and where you see your natural inclinations would be and what would feel strongest to you.
All right, this next question is for Mr. Rushing. Is it okay if I'm not sure of which specialty I want to study upon entering the program?
Upon entering, I would advise you to at least have an idea of what you're applying for. Once you are admitted, it is not, I'm not going to say impossible to change, but it is very, 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 very difficult to change once you are enrolled. So you want to have an idea, and I would echo the same sentiments. Explore as much of the nursing environment as you can. And a lot of, in your rotations for the BSN programs, you had an opportunity usually to see a lot of different areas. And so I would encourage you to use that time if you are going through a BSN program. Start looking at the jobs, see if it's something you think you could do day in and day out. If some of it you'll know right away, I can't do this. And there's a lot, for example, with pediatrics, we have seen there's a lot of people who cannot do that. They don't like it and they know it right away. So I would not advise you to apply for a pediatric N.P. program if you know that you can't do that going through your education. So use the opportunity to see, to experience, and to talk to the pros and cons, to have an idea before you apply as to where you think you might want to wind up and what your career choice will be.
Knowing that you can make a change anywhere along the way. You can complete that education and then go back and get more. I've done it. Probably a bunch of people at this table have done it. So knowing that in nursing, you can change direction and get a little bit more education and learn those skills that you need.
All right, I'd like to open this question up to the entire panel. What is the number one advice you would give applicants to help them stand out compared to other applicants?
I guess I can speak to that, since I not only direct our graduate entry program, but chair the admission committee too. When we look at applications for our program, we too have academics as well, transcripts, GREs, personal statement, recommendations, and we interview each of our candidates as well, either in person or by phone. By the way, we have 2 students in our current first-year class from UC Davis, by the way. So what we look at the entire application holistically. We don't score it or rank different parts. We try to really get a feel of the individual person. And because our program, even though there's 3 phases and you can come in and opt out after the first phase, after you become an RN and receive the Master of Nursing degree, we're really looking for individuals who are planning to go on into advanced practice. So we look for that, someone who has in their personal statement distinguished between generalist or RN level practice and advanced practice, who has indicated an area they're interested in, although we don't require that our students commit on entry into the program to an advanced practice major. They can change anywhere along the way, but we're looking to see that the individual has really prepared themselves, because when you already have a college degree and you're now making another commitment to go into a different discipline than what your major was in, even though we value all of that background, it's a huge commitment and a huge decision. We have students from all over the country, so many have moved to Ohio. So we're looking that the individual's really done their homework.
One of the things I could say about Chico State and what we look at, I would echo some of the things that were just said in terms of looking at the entire application and not having one area stand out. I think the other thing that we consider and look at, we are a small program because we are in a rural area, and so we look at 20 students as our admission cap, because right now in the online environment we don't want a huge class for online learning. And so what we look at really is the option that the potential master's student has taken is how well they really are prepared and are committed to that area of moving forward in. We do allow students to change direction in that first year when they're in the core year. It's something that can happen. Because we're small, we would rather not have it happen because our numbers are important in terms of teaching. But the other areas that would stand out, because I am the head of that in terms of being a graduate coordinator and also being the person who chairs the admission process, is also potential students really looking at how they're going to fit this master's education into their life, because that does become an issue. And because we're an online environment, students tend to sometimes feel that the commitment is somehow different, and it isn't. And we do everything we can to engage students online constantly with each other and with instructors so that they have that sense of a classroom and a cohort. But I think it's important to look at your life and say, what is my commitment to this higher level of education, and how am I going to make this work? And so students that demonstrate that in their application process are also students that then stand out for us. Thanks.
So I can just say that I agree with most of what's been said, if not all. We are, because our MSN program is the Clinical Nurse Leader program, you certainly can choose to go into a Doctorate of Nursing Practice program at a later date if you decided to become a nurse practitioner. But knowing that ahead of time helps you take the right courses, because we have different levels of, say, physical assessment, whereas the D.N.P might take it at a doctoral level, you might be taking it at a master's level, and so we could do that if you knew where you were headed. So we do allow you to make changes. I think for me and for our admissions team, what stands out is passion, and I know I heard that earlier. I think seeing your passion, being able to read that and why you want to do this furthering your education, and some of yourself in that, telling us about yourself and your experience that has led you to this decision. And then also highlighting sort of what you want to do, like what's your goal for doing this. And if you have a clear goal and you can speak to that passion and show us how that experience has led to this decision, I think those are the applications that stand out for us.
I'd agree with all of this as well, and I chair our admissions committee. And thinking about just then the two major points to reiterate are actually when you're filling out your application, addressing the specific program that you're applying to, because many of our schools have different programs. And as you're completing your essays, thinking about using your authentic voice, that who you are, so that as we're reading these applications, we naturally see, we don't work hard at figuring out what the passion is, but we can get a really good sense of who you are and what you're bringing and what you're hoping to achieve. You may not already have it fully figured out, but you know a general direction in what has brought you here, and by sharing that with us, it really gives us a lot of information about you.
Well, and I'll ditto as well. When people ask, what can I do to make my application stand out, and I get that daily. We all get stacks of really qualified applicants for all programs. And that statement where you really are explaining why you want to do it is the best way to let other people know why you are considering it and why you would like to do it. If I had to say anything, everyone's going to have great grades, great test scores, great recommendation letters, and that's going to be universal. But where you can separate yourself from everybody else is how well can you explain to perfect strangers why you want to do it and why you are passionate about doing it at that institution at this time.
All right, thank you. That is all the time we have for today, but I'd like to thank our speakers for being here and educating us. Please give them a round of applause. Thank you.